The Trump administration says the daily number of deaths caused by the coronavirus may double by June 1st. That's according to the New York Times, which obtained an internal model compiled by FEMA and the Centers for Disease Control and Prevention. The document says the number of daily deaths may approach 3,000 by the beginning of next month. And during a town hall on Fox News Sunday night, President Trump said the overall death toll from the coronavirus is expected to increase from his earlier projections.
We're going to lose anywhere from 75, 80 to 100,000 people. That's a horrible thing.
The administration is pushing back on the reported CDC projections in the Times, saying in part, quote, "This is not a White House document, nor has it been presented to the coronavirus task force or gone through interagency vetting. This data is not reflective of any of the modeling done by the task force or data that the task force has analyzed." The statement also emphasized the administration's reopening guidelines. The topic was also on the president's mind Sunday. He praised states that have eased restrictions and criticized others for tightening theirs.
Certain states are going to have to take a little more time in getting open, and they're doing that. Some states, I think, frankly, aren't going fast enough. I mean, you have some states that, Virginia, they want to close down till the middle of June.
But according to data compiled by the New York Times, 7 states, Iowa, Minnesota, Texas, Tennessee, Kansas, Nebraska, and Indiana, are all seeing an increase in coronavirus cases as they reopen. Meanwhile, the Trump administration is continuing to slam China for its handling of the early stages of the coronavirus pandemic. Here's what President Trump had to say Sunday, followed by Secretary of State Mike Pompeo.
They tried to cover it. They tried to put it out. It's like a fire. You know, it's really like trying to put out a fire. They couldn't put out the fire.
We can confirm that the Chinese Communist Party did all that it could to make sure that the world didn't learn in a timely fashion about what was taking place. That created enormous risk, and now you can see hundreds of thousands of people around the world, tens of thousands in the United States have been armed.
Major is CBS News chief Washington correspondent. Ed is a CBS News political correspondent, and Caitlin is our CBS News political director. Wonderful to see all of you. A lot of news to get to today. Ed, I want to start with you. Vice President Mike Pence and members of the White House Coronavirus Task Force held a call with governors Monday afternoon. CBS News obtained some notes from a participant who was on that call. What can you tell us?
Yeah, this is becoming a weekly update, essentially, for the federal government to sort of talk to the states about what's going on. Among other things, the White House urging states to pick up the pace in terms of allowing hospitals and clinics to start performing elective surgeries again, arguing that there are other people out there in this country that have other health issues and that they should be allowed to do so. It's also designed to be another way to sort of push the economy and society in general back to some sense of normalcy. They also discussed plans to distribute about 12.9 million testing kits to the states. That's part of a vow from the administration to do so, and are generally pleased to see that about 41 states so far have released official reopening plans with an understanding that the others are still working on it. And they continue to believe, are heartened by the fact, at least Vice President Pence and the federal officials on the call said, that the numbers seem to be stabilizing to some extent, that it's essentially the case rate isn't necessarily climbing in parts of the country where have been major outbreaks in the past, but an understanding that perhaps there are other parts of the country that are still yet to see some of the worst. Here in the Washington area, for example, now officials telling CBS News that the peak may come here in the next 2 weeks or so, and the timeline is different in other parts of the country. So part of a regular series of calls they're doing, but no signs of any real disagreement or drama today in the briefing, which is a sign that the federal government and the states are somehow figuring out how to move the country on as this pandemic continues.
Well, Major, during Sunday night's town hall, we heard the president praise states that are reopening and criticize those that have extended social distancing guidelines. But several states that have reopened are seeing an increase in coronavirus cases. Is there a sense among the president's allies that he needs to dial back a bit on his statements on reopening?
Well, the president has dialed back. He's much less visible than he was just 2 weeks ago when daily coronavirus task force briefings were, in fact, that daily. And the president was the central figure in all of those briefings and the central voice of the administration on this question. And there hasn't been a briefing for the better part of a week and now a couple of days. The president has taken questions from reporters in different venues, but the idea of this sort of concentrated, focused place in which the president and only the president, or largely the president, is the voice of the administration's response to COVID-19 have in fact disappeared. And the messaging, therefore, is a little less constant. It's a little more diffuse, and there is some deference to states on this question of the pace of reopening. But we are now going into this next adaptive stage of COVID-19 as states, as communities, and as a nation. And to Ed's point, yes, the vice president on that call was generally reflecting the statistical good news that there's a bit of bad news in that stabilization. We're not seeing a downward slope nationally. Places that are on a downward slope are being replaced by places that are on an upward slope. And in some cases, to your point, Elaine, that upward slope is happening in places where the restrictions are being loosened more rapidly. And we are now at this adaptive phase where we're going to see what a reopened or nominally reopened economy looks like with COVID-19 still present, still highly contagious, and people asymptomatic, meaning they have no idea that they're infected whatsoever, circulating more rapidly and circulating in different places at a higher level of frequency. And then we're going to see what the case rate is. The one good thing I think we as a nation and as states and as communities can all say is almost nowhere in America right now is the medical system at a stress point where it will tip over. And I had a conversation last week with a name I know Ed O'Keefe will remember well, and certainly Caitlin will, former Senate Majority Leader Bill Frist, world-renowned heart and lung transplant surgeon, deeply involved in counseling Nashville and the state of Tennessee on reopening. And he said 2 or 3 weeks ago, New York, New Jersey, and a couple other places were very close to just tipping over and having their entire medical system collapse in on itself. We don't have those problems anywhere right now. We have hotspots, we have areas of concern. But as we reopen our economies gingerly, cautiously, and we see caseloads increasing, the next big thing to concentrate on is, are those new cases so dangerous that they require massive hospitalization and intensive care remedies? And if they do, then we really have to hop on it and re-examine the pace of reopening.
Right, the stakes really could not be any higher. Caitlin, the president was asked, looking ahead, if November's election would be a referendum on his handling of the pandemic. Now, he said no, but said he thought it would be a factor. So how are the president and his campaign trying to frame their handling of the coronavirus pandemic?
Well, as Major just rightly pointed out, we first saw daily coronavirus task force briefings that were trying to fill a vacuum and show leadership in terms of here's what we're doing on healthcare, informing the public. As we discussed before, the president muddled his message on that quite a bit in those daily briefings by getting into fights with the press and bringing up other topics. And so they've since scaled those back. And now they're focused on trying to get the economy to reopen. But as we saw in our poll this past weekend, the two top issues are the economy and coronavirus. That's what voters nationally said they're going to be they'll be looking to that will affect their vote this fall. And so we don't know how that's going to go yet and how soon we will be through this pandemic, how soon the economy will be fully reopened. And it could be bad news for the president if both those things aren't going his way come election day. And even before this, healthcare and economy were the number 1 and 2 issue for most voters, even in the midterms. And so there's things that are very personal to people. People are losing jobs, they're losing loved ones, they're not able to say goodbye to their loved ones sometimes. So, and all politics is just, how does it affect me and my family and my friends?
And so, Caitlin, if that is, in fact, the focus here, and there will be a great deal of attention paid on the president's sort of leadership overall, what could that potentially mean for Republicans running in down-ballot races?
Well, in 2016, when Donald Trump entered the scene and became the nominee, he was an anomaly. And a lot of Republicans said, didn't really know how to deal with him because they thought we're the Republican Party and then there's Donald Trump. Now there's no question that the Republican Party is Donald Trump's party. And I think that's very important because in 2016, a lot of the Senate candidates ran their own very state-focused, localized races. And now basically everything has been nationalized. And a lot of it is about President Trump and the Republican Party at large. So I think it'll be interesting to see if any of these Republicans in tough races will actually start to deviate a bit and try to not tie themselves as much to the base or the president. And more importantly, will it even matter? Because I think at this point it is his party, and basically anything that Donald Trump does is going to be reflective of the Republican Party down ballot as well.
So, Ed, let me turn to you. Given what Caitlin just outlined, then, does Joe Biden's campaign and do Democrats in other races feel that focusing on President Trump is a winning strategy, or will be, for them in November?
Well, even if they're not focused on him, given that the news coverage kind of is, it does appear to be helping them to some extent. Look, he maintains a narrow lead, a single-digit lead over the president in a national head-to-head matchup. In our latest CBS News poll, he's leading the president by slim single-digit leads in key battleground states like Michigan and Florida recently. And so they're kind of okay if the focus is on coronavirus and the botched response, because that's reflective of the president. And polling shows right now, of course, that generally Americans aren't pleased with how the response is going. That's partly why you've seen the president and his allies try to shine a little more light on the Tara Reade accusations, which I know you're going to talk about later, and partly why the president is now also eager to get out of the White House, get out of Washington, try to project some sense of command, and get back out on the road, something that he enjoys doing, and usually a venue, wherever it is, where he can thrive a little more. But of course, he's not holding rallies anytime soon. It's interesting, in our polling over the weekend, we asked the question about the fact that neither the president nor Joe Biden can physically be out on the road. Something like 11% of people said they're not seeing enough of the president. A majority, or a plurality at least, said they're seeing more than enough of him. For Joe Biden, general belief that people aren't seeing enough of him, and about 47% of people said they would like to see more of him. So he's got to be able to insert himself in some way in the minds of some voters. And the fact that neither of them can really leave their homes in Washington or Delaware doesn't seem to be a big factor in the ultimate decision that voters will make. Something like 84% said in our poll that the fact that they can't be out physically campaigning is not going to be a factor. In other words, go ahead, guys, stay home. We'll figure out how to vote for you or not based on other factors, which I think is frankly reflective of how politics may really change dramatically in the wake of all this, not necessarily even from a medical or societal standpoint, but if there's less of a premium on having to hit the road and more of an ability to do this virtually or digitally or just over the air, future campaigns very well may reflect that, and you may see a curtailment of these on the road and the rallies, and there's still conversations going on about the conventions. Definitely something that will have to be considered when this is all over.
Absolutely. Well, Major, the president is now saying that the overall death toll from the coronavirus may increase. Give us some context here, Major. How does that compare to what his health officials have been saying all along?
Well, as Dr. Deborah Birx, coordinator of the coronavirus task force, said again this weekend, she's never moved off of the modeling and the statistical probabilities that she announced quite soberly with the president and Vice President Pence and others more than 3 weeks ago. The range is 100,000 to 240,000 with mitigation, with social distancing, with all the things we as a nation have gone through. She's still saying there. The president, though, a couple of weeks ago started to say, things are looking so much better. Looking at the data that was showing promising results in New York, New Jersey, other places that were emerging hotspots that got settled a little bit more rapidly than the original projections suggested they might. New Orleans, Detroit, Chicago, Boston, Providence. And the president said, quite optimistically, we could be around 60,000, maybe lower than 60,000, maybe 65. Well, That so late last week began to ramp up. And then on Sunday, he started nudging ever closer rhetorically to this $100,000 number, 100,000 case and death number, rather. And that suggests that internally there is modeling that is telling the president the upward trajectory of deaths continues and is going to continue through the summer months. And that's something that the president has to begin to acknowledge, because if he doesn't acknowledge it, he is a bystander to this ongoing, moving tragedy. And that's the biggest single question for campaign 2020. Is Donald Trump, the president of the United States, a bystander to history who sometimes miscommunicates, talks optimistically, but in ways just seems completely out of touch with the science, the medicine, and the reality? Or is he not a bystander to history, but a driver of history? That's why the president talks so aggressively about therapeutics and a vaccine. He wants to be the person, the president, the candidate viewed as driving the optimistic and breakthrough history of this virus. Yes, he talks about it. Those results haven't materialized yet, and there are plenty in the scientific and medical community who believe he's being overly optimistic about therapeutic drugs that can lessen the effect of COVID-19 or a vaccine that could be available as early as January. But he wants to be that driving force of history against COVID-19, not the bystander. And on the death toll numbers, increasingly in the last couple of weeks, he looks overly optimistic. It's ongoing and rolling story of tragedy, death, and virus or viral catastrophe.
Major, just to follow up, speaking of remaining in touch with the science and the medicine here, a lot of Americans had gotten very used to those daily coronavirus task force briefings in which oftentimes we would hear from Dr. Birx and Dr. Anthony Fauci and other members of the coronavirus task force. Now that those briefings have been scaled back, what happens now? What is the way in which people will be able to hear from those top health officials aside from, say, appearances on the Sunday shows?
It's much less common, and I think that's a void that is creating an absence of scientific and public health evaluation of what we're about to go through. We're going to go through a rather visible and important public policy, public health, science and medicine, and economy experiment. We're just starting. We're on the very edge of it as communities begin this experiment of reopening and re-engaging and have people act as consumers with masks and distancing, and things begin to open up. One would think that you would want to have readily available public health officials to say, here's what we're seeing, here's what's encouraging, here's what's worrisome, and here's what we're doing to make sure we're ready in case anything happens. One of the things I've been most astonished about in the last week and a half is not so much the absence of the president, but the absence of those who are readily responsible for dealing with things like COVID-19 outbreaks within what we used to call slaughterhouses, what we now more gently call meat processing plants, and what that might do to the availability of food supplies in the United States. Now, the U.S. Department of Agriculture says over and over, everything is going to be fine. But these things appear to be concentrated, and if there are hot spots visible, they're in counties or places where slaughterhouses, we now call them meat processing plants, are seeing higher levels of infection. That's a big public health issue. It's also a big economic issue. It's also a big sustainability issue, meaning how do we sustain our national food chain? You would think the administration would want to have voices available to talk about what is happening, what's not happening, what to be aware of, but what not to be afraid of, all those sorts of things. And they're absent from public view, and they're absent from the ability for the public to take that in and make rational choices as they look at their future with COVID-19.
It's a political issue too, Elaine, because a lot of this is happening
go ahead, Ed.
in red states or in Western states where the president is prone to be popular, and it's states that were resistant to putting in place stay-at-home orders or other restrictions. I mean, this has happened in Nebraska, in the Dakotas, Colorado, which is a now leading essentially Democratic state, the eastern shore of Virginia and Maryland, which is a more conservative part of both of those states. But it's happening in those rural areas of the country that didn't initially think it was going to happen to them, and that have been far slower to react to all this and don't have the medical infrastructure in place, the public health infrastructure necessarily, to deal with this in a big way if it becomes an even larger problem. So it's, to Major's point, where's Sonny Perdue? Where are the folks at USDA and the Food Inspection Service to perhaps provide a little more clarity? We haven't seen much of them yet.
Right, and it remains to be seen whether or not they will make themselves available here as more and more challenges arise as a result of this pandemic. All right, Major Garrett, Ed O'Keefe, and Caitlin Conant, so good to have all of you. Thank you all, and take care. Thank you.